Totally walang tao na cancer-free. We have 20% cancer in our body na pwede yang mabuhay pag pinid ulit natin sila ng wrong food. Natutulog lang sila, nahihilo pa lang. So, kailangan yung sundalo ng katawan natin mas malakas kaysa kanila. Yes. Uminom ka ng PPARs, gagaling ka. Talagang walang aksidente. God-given po. Thank you po.
Breast cancer stage 4 patient, and they tested SimplyNature liquid PPARs on the breast cancer cells. And what they found was that SimplyNature PPARs liquid actually induced caspase 3, caspase 9, and cytochrome C. So what this means is that SimplyNature PPARs liquid was able to induce cancer cell death in breast cancer cells of a breast cancer stage 4 patients. So with just these three properties of SimplyNature PPARs, it would go a long way already.
You gotta watch all your comorbidities. Our products are actually very effective for inflammation, very effective for managing blood sugar, blood cholesterol. Alright. If you're using metformin, PPARs is actually clinically proven to work in synergy with metformin. So you gotta watch. That means your metformin dosage will be tailored downwards because you don't need so much metformin. It actually works in synergy together.
It enhances the immune system, so as you can see, helps you minimize the side effects of the chemotherapy. So it has good antioxidant properties, good anti-inflammatory characteristics.
SimplyNature! Always with you from start to healing!
Hi everyone, these are the important questions. Do I need to go for chemotherapy? How many sessions of chemotherapy do I need? What about immunotherapy? What about surgery? What about CT scans? Well, join us on our Simply Healed program every Thursday nights at 7:30 p.m. Singapore, Hong Kong and Philippine time. Our sessions are interactive, featuring a live Q&A with experts and doctors who will answer your questions in real time. You can type in your questions and get immediate, personalized responses. This is your chance to take control of your health. So take advantage of this informative and supportive experience. Visit our Facebook page and message us on Messenger to find out more. See you there this Thursday.
One reason why I recommended initially PPARs is because it can induce lung cancer cell death. The main reason why I tried PPARs liquid, and it did well for the patient. It helped with the tumors. The enlarged abdominopelvic lymph nodes were not detected. This was gone. So that was something that I was actually quite surprised. A 12-centimeter tumor disappearing.
Everybody turn to your neighbor and say, do more. Right? Don't just think there is no one product that will cure you of cancer. Okay, that is like it's like a scammer trying to sell you something. All right, it is a comprehensive approach. When you need surgery, do the surgery. But prepare for the surgery so that you recover well, right? And then if you need to do chemotherapy, radiation therapy, do it. So this is where PPARs really comes in. It's a gene activator, so it's a signaling pathway. It switches on your pathways, your systems. Then the other nourishment that you take will be properly used. Is it easy to understand now?
Now let's not keep you waiting. We are now officially opening the AMA or Ask Me Anything portion.
So she has to take maybe just the capsule or the powder just to regulate blood sugar. And then undergo the surgery. And after the surgery, to aid in wound healing also and for recovery, she can continue the capsule.
I can safely say this. All LJ products are great. But if you have acute illnesses like cancer, then we are a world of a difference. Because if you want chlorella, take chlorella. Diba? If you want spirulina, take spirulina. When you take SimplyNature PPARs, you're taking our microalgae for its PPAR agonist.
We are always with you from start to healing.
Yung sister ko had the symptoms of diabetes. Siguro 10 years na. Madalas siyang umiihi, tapos laging pagod, pumayat, mataas ang BP. Tapos siyempre, mga non-healing wound.
Yung sa paa po ni ma'am, paano po yun nag-start?
Okay. Kasi ganito yun eh. Yung first na hospital niya, not because of diabetes. Ang una niya, pneumonia. Ayan. Doon nalaman na may diabetes din siya. By accident. Right foot niya, may para siyang matang isda lang. Yung maliit na itim lang. Tapos napapaligiran lang siya ng parang dilaw na kulay na dilaw. Ring sa sugat na yun sa center. Tapos tinanong ko, bakit? Hindi niya daw alam anong reason. So sigurado ko dahil nga may background ako sa medical, siguro dahil yun ay lumala na yung taas ng sugar niya, hindi niya na monitor, hindi niya nabibigyan ng gamot, nagkaroon siguro siya ng komplikasyon. Yung nerve sa paa na damage na. So hindi niya na nararamdaman na minatapakan pala siya. So probably yun siguro yung nangyari. Minatapakan siya, nasugat yung paa niya, maliit lang, tapos hindi niya naramdaman. Lumala. So nagkaroon siya ng lagnat on and off, nakahiga lang siya. So sabi ko sa kanya, so anong plano mo? Sabi ko, pa-check na natin yan. So pina-check namin as OPD, chinek, binigyan, niresetahan ng gamot, tapos tinignan yung sugat, binusbos. Pero kapiranggot lang ang tiningnan. Tapos in-advise na lang kami, linis, at 7 days na gamutan ng antibiotic. After na 7 days, lumala lalo. Yung pinaka-pamamaga niya, lumaki lalo. So sabi ko, ay, na-infect na to. Nilala ko sa emergency room. Ayun, doon nalaman lahat. Mababa pala hemoglobin, mataas masyado yung sugar, yung diabetes niya, talagang marami ng komplikasyon.
Ano po yung plans ng doktor niya?
Na-refer siya sa ortho. Ang plano sa kanya ay putulin. VKA or the below the knee amputation. Hesitant din kami pumirma ng consent. Then later on, ni-refer naman siya sa plastic surgeon. Nagsabi naman sa amin na maganda pa circulation. Might as well na tulungan na lang natin yung paa, linisin, wound dressing for twice a day, then debridement as needed, religiously. So yun ginawa namin, twice a day kami naglilinis, tulungan kami ng husband niya, hanggang ang nangyari, gumanda, pero andun pa rin yung plan na putulin. Hanggang makita na gumaganda na, ayun, hindi na naulit yung plan nila na maputol yung paa.
Kasabay po ba nun may mga tinitake pa siyang gamot?
Bukod doon sa antibiotics, bukod sa mga gamot na binigay ng doktor sa ospital, may tinik din siya na alternative medicine, yung PPARs. May kamahalan. So, sinugal ko para, kasi kailangan kung di mo isusugal yun, baka maputulan talaga. Kasi kahit naglilinis kami ng paa, tapos nagdidibri, pero parang slow yung healing process niya. So, I tried na painumin siya at 10 tablets at AM and 10 at lunch and then 10 at the evening. And the soft gel, twice a day also. So, religiously binibigay ko yun sa kanya. Ang dati kasi dahil nag-peak yung WBC niya, medyo nag-septic siya. Sa mga nakakaalam, sabihin yung infection kumalat na sa buong katawan. Kaya nagkaroon ng problema yung kaisipan na nawala sa wisyo. Dramatically, yun yung maganda doon. Dramatically, after 1 to 2 days, parang nakita ko siya ng improvement. Doon, nakita namin na sa help ng antibiotic and together with PPARs, sabi ko, maganda yung kinalabasan. So, why not continue? Hanggang nakita ko rin na gumaganda yung healing process. Tapos, yung WBC, nag-dramatically from 46. Imagine, 46, dramatically bumaba siya ng 39, 33, 27, 19, 15, and then 11, 9, 7. So, nakikita mo talaga yung changes na nagawa ng gamot na yun. So, yung support ng family ay mahalaga sa recover ng pasyente. So, una, yun yung talaga nakikita ko, yung support system. Then, secondly, syempre, with the help of the advanced technology, like yung mga ini-introduce ng mga gamot, hindi ko pwedeng alisin yun sa scene, sa scenario. So, ako kasi, dahil nga nasa medical field ako, medyo alam ko yung mga ganyang mga alternative medicine and evidence-based ako. So, sa PPARs, sabi ko nga, maganda yung result. Ito walang harong biro to. It's not joke. Yung mo ako binayaran So, it's no joke. Talagang maganda yung yung nangyari sa kapatid ko, lalo na yung wound healing. Yun yung nakikita ko yung wound healing talaga. Nag-granulate siya, gumanda yung circulation, nabuo ng laman, okay? Nagkalaman yung mga paa niya na dating wala. Makikita niyo naman sa picture, di ba? Dating wala, nagkaroon ng laman. So, na-prevent natin yung pagputol. I can say na effective. Okay, effective yung PPARs.
Ano yung ma-advise nyo sa mga patients na same case sa sister ninyo?
Okay. So, I advise them to try. Then, kagaya ko, gusto ko may ebidensya na experience ng on hand ng ate ko. So, ganun din yung papayo ko. Try to experience yung healing, try to take the medicine religiously despite medyo may konting kamahalan, but then kung titignan mo naman yung long-term na gamutan, mas mahal yun. Tsaka hospitalization. At yung, syempre, yung recovery. Yun yung maganda doon. Yung recovery, mapabilis. So, try ninyo. Hello, I'm Joel Elcano. My sister, diabetic since way back 10 years up to now. Because of Simply Nature, hindi niya na kailangan mag-amputate. Yung recovery niya, yung unti-unti, nagkaroon ng maganda, nagkalaman yung kanyang mga paa. Still recovering, yet nakikita ko yung magandang bunga. And that is because of Simply Nature PPARs. And I trust Simply Nature.
Assalamualaikum warahmatullahi wabarakatuh. Bismillahirrahmanirrahim. Ako si Nur Haji Norma Yusuf, taga Zamboanga City. Pero dito na ako nakatira sa Maynila. 13 pieces na bukol, pero yung mga iba maliit siya. Pero yung itong isa malaki siya, parang umabot na ata ng 3. Kaya nga ito sabi ng doktor, kailangan tanggalin na. May kaibigan ako, try ko daw itong yung PPAR. Pangalawang gabi, naramdaman ako parang iba. Yung parang may langgam na parang gumagalaw ganyan hanggang dito, hanggang sa talampakan, ganon. Pangatlong araw ko, Parang kung sumakit yung dito ko, parang gusto ko talaga, pag ano ko ganyan sa CR, yun parang umano lumabas talaga na ano, ganyan, napakarami talaga. Siguro sunod-sunod yun, 3 araw, ganun. Tapos sabi ko, pagtapos yung dito ko, minsan yung parang, ganun-ganun ako, parang masikip dito, parang minsan sumasakit dito ko, ganyan. Yung nag-ano na ako dito, umabot na ng mga 5 days, ganyan. Parang nawala yung sakit dito, nawala siya. Parang hindi na ako ganun-ganon. Pag nagsalita ako, parang tuloy-tuloy na, wala na akong halos maramdaman. Kaya siguro, hindi ako, sabi ko, parang ayaw ko magpa-opera, siguro mayroon talagang gamot para dito. Binigay ng God. Ngayon, hanggang ngayon, parang maganda ang, maganda ang pakiramdam ko. Yung high blood ko, pag ko, parang magandang tinanggal ko na yung sa cholesterol ko, hindi na ako, pero yung sa cholesterol ko, pag tinatanggal ko yon, parang hindi, mga 2 araw, parang masama ang pakiramdam ko. Pero ito, 14 days na, ngayon 14 days na, basta 2 weeks na, hindi ako uminom ng subastatin, wala akong nararamdaman na parang maganda ang Kaya yun, ngayon bumili pa ako ulit ng tablet. Oo. Kasi sabi ko para para lumakas talaga sa akin ng Kasi nararamdaman ko talaga na maganda. I did normal use of. Ay bukol ako dito sa liig ko. 13 piraso. Umabot na ng 3 cm. Take ako ng PPARs 2 times, morning at saka gabi. Pag numulok ako, hindi ko na siya mararamdaman. At saka kinakapa ko siya, parang nawawala, parang wala na, hindi ko mahawakan. Hindi katulad ng dati. Salamat, SimplyNature.
Episode of Simply Healed webinar. I'm Sheila, your host, and we are glad to have you with us today on a relatively new setup of our webinar. Today, we are diving into real science-based solutions for better health. To quickly recap last week's webinar, we tackled a powerful topic, beating cancer with strength and science. It was an informative session with plenty of great questions, well addressed by our experts. And tonight's topic is entitled Strength and Storm, How Cancer Patients Stay Resilient with SimplyNature PPARs. Now, whether you're tuning in as a cancer patient, a survivor, a caregiver, or someone who simply wants to learn, you're here for a reason. And you're looking for strength or hope for solutions that work alongside conventional treatments, and we are here for you. Let's be honest. When someone hears the word cancer, life changes in an instant. It's not just about battling disease. It's about handling the side effects of chemotherapy, the emotional roller coaster, the fatigue, the loss of appetite, and the fear of what comes next. Chemotherapy, for example, works by targeting fast dividing cells, but that means it often affects healthy cells as well. So especially in the bone marrow, digestive tract, and even hair follicles. That's why patients often experience low immunity, nausea, and hair loss. It's a powerful treatment, yes, but the body pays the price. And the question becomes, is there a way to protect and strengthen the body while going through this journey? Now, that is where PPARs come in. SimplyNature PPARs are plant-based molecules, short for peroxisome proliferator activated receptors. These are natural transcription factors that help regulate inflammation, immune response, and cell metabolism. Sounds technical, I know, but here's what it means in simple terms. Number one, PPARs support your immune system, making you less prone to infections, especially when your white blood cells are low due to chemotherapy. Yes. Now, number two, PPARs have anti-inflammatory properties, which can help reduce chronic inflammation linked to cancer progression, pain, and fatigue. That is true. Some of our patients who are experiencing pain are caused by chronic inflammation. Now, next, PPARs can actually help the body manage glucose and lipid metabolism, which is very important because cancer cells thrive on sugar. Supporting healthy metabolisms create a less favorable environment for tumor growth. Next, they aid in cellular repair. This is very important. The cellular repair and detoxification, helping your body eliminate damaged cells and toxins introduced by chemotherapy and radiation. And most importantly, SimplyNature PPARs are natural, food-based, non-toxic, which means they're gentle enough to be used alongside medical treatments, even maintenance medication. Okay, so without interfering their effects. In short, PPARs are like giving your body the internal tools it needs to keep functioning even while under heavy stress from cancer treatments. So this isn't just about surviving treatments. It's about being strong enough to recover, to bounce back, to keep your energy up, and to protect your body's vital organs through every stage of your journey. Well, we don't say zero side effects, as we always say to our patients that we talk to. But we've seen patients who use PPARs experience with faster recovery time after chemotherapy, less fatigue, improved blood markers. We need that for the next session of chemotherapy, right? And even better appetite and sleep. And while everybody is different, the common feedback we hear is this: I feel more stable, more protected, and yes, more hopeful. Now, at Simply Nature and Simply Healed Medical Group, we believe healing is not just about fighting disease. It's about supporting your body, calming the mind, and restoring hope. So this webinar is an opportunity to understand how to use natural cellular support during your cancer journey and discover the role of lifestyle nutrition and science-based plan solution in recovery. And to take control, not just of your treatment, but of your overall well-being. So tonight, you will learn what it means to find strength in storm and how PPARs and Simply Nature and Simply Healed Medical Group team can be your partner in that journey. The intention of today's webinar is to make sure that we answer more questions from all of you, for us, of course, to be able to empower you even more in your cancer journeys. So without further ado, let's dive right in. Leading tonight's AMA or Ask Me Anything portion, which we are about to go to, are two highly respected health experts. First up, it's an honor to introduce Dr. Jansen Kalala, a graduate of St. Luke's College of Medicine and diplomate of both the International Board of Lifestyle Medicine and Philippine College of Lifestyle Medicine. Currently serving as a consultant at renowned institutions, including Alta Integrative Medicine and Wellness Complex of Perpetual Health Medical Center Las Piñas, Tree of Life Wellness Center, Centro Holistico, and Simply Healed Medical Group, where he practices integrative oncology. Joining him is a successful entrepreneur and he's an international speaker on a wide range of topics from personal success to healthcare, our CEO and founding director of Simply Nature International and PPARs expert from Singapore, Mr. Shyan Lim. Good evening, Sir Shyan, and good evening, Doc Jansen.
Good evening, Sheila. Good evening, Doc. Doc, I'll see
Hello,
you
good evening.
for lunch this Sunday, right? Yeah.
Yes, yeah. I'll see you for lunch. Yeah.
All right. Okay, Sheila, let's go to the questions.
You're going on a lunch date.
Yeah, we're going on a lunch date.
Okay, so for our first question for tonight, all right, sent to us privately by Miss Norma, a housewife from Antipolo. I'm going oral chemotherapy right now. Can you recommend something for me? Oral chemo.
Wow, you number one, I'll make my first recommendation before Dr.
Yeah.
Jansen is go and have a consult with Dr. Jansen because he's actually the perfect doctor to advise you what to do during your chemotherapy so that you will recover well. You will be able to finish your chemotherapy with as little side effects as possible. Not that it's gonna be totally, but you're gonna be well and you're gonna recover fast. So let's let Dr. Jansen give you some tips, but I really advise you because Dr. Jansen is so knowledgeable about the protocols you're going to take. He will be the best doctor to advise you on the journey. Doc?
Yeah, it's really very difficult to recommend something which
without a consult.
the concern is not specified. Yeah, so oral chemo, there are a lot of oral chemo. Sometimes the word chemo is even, has a lot of sometimes it's also a misnomer. Sometimes the patient is taking something which is not chemotherapy, but they keep on saying that it is chemotherapy. So there's a misnomer as well. So but for cancer patients in general, no, the one thing that you should make sure that you follow is your diet and lifestyle. Don't eat foods that you should not be eating. So, like, processed foods, foods that have very high sugar, very low in fiber. So make sure you eat plenty of fiber. Yeah, plant foods in general. No, so yeah, make sure you follow that and everything. You'd go a long way already with having a with following a good diet. So yeah, and of course, if you want something like a supplement, then you can try SimplyNature PPARs. But of course, no, to be sure that it doesn't have any interactions whatsoever with what you're taking, I have to speak to you. Yeah. So yeah, I hope that helped.
All right. So on my side, I just want to let you know that even before you meet Dr. Jansen, the first thing you can do is take SimplyNature PPAR tablets, because regardless of what your protocol is going to be, SimplyNature PPAR tablets is actually plant-based whole food. Is literally a very special strain of microalgae. So you're actually taking vegetables in tablet form. All right. So, sometimes for many people, especially for patients, it's not easy to change the way you eat. And sometimes because you have a loss of appetite, it's difficult to eat. So that's the part where you can start with the right support. And SimplyNature PPAR tablets is that. I would also advise you, since you're a cancer patient preparing to go for chemotherapy, to go for soft gel capsules, right? And then have an important consult with Dr. Jansen. And then he will, what Dr. Jansen will do, right, Doc, is that he will take a look at the drugs that you're going to take, right? The therapy that you're going to go for. Many cancer patients think that they're going for chemotherapy, but it could be a mixture of hormone therapy, immunotherapy. There might be even radiation therapy involved. But usually patients lump it all together into this one word called chemotherapy. Dr. Jansen will take a look at what you're actually going to take, the actual drugs that you're going to take, and then he will share with you an actual plan, right? A strategy to keep you healthy throughout that whole process. It's very important for all our viewers, right? Because many viewers will ask us this question: how do they prevent recurrence? Recurrence, it means when the cancer comes back. So number one, we are all very confident, and we want to start with that confident position that you're going to win your fight against cancer. Let's start by believing that, right? And what's important is to make sure that the cancer doesn't come back. So there are things that you can do, right? We've heard so many success stories today. This is year 2025. It's not 2010. So many patients survive cancer. The challenge in 2025 is not defeating cancer, is what happens when the cancer comes back. All right. So this is the part that is difficult, because the chemotherapy drugs that gave you success the first time round can't work again. The cancer has usually developed resistance and mutated. So we want to prevent recurrence, and that is part of your understanding. You should have a discarte right from the beginning on how to prevent or minimize recurrence for your cancer, even as you begin your journey fighting cancer. So Dr. Jansen, have a consult with him, ask him what's the plan, what happens, doc, when I am going to be cancer-free, what do I do after that? So you know the whole process, and so that you will be totally victorious against your fight with cancer. Sheila?
Right. I just want to quickly share as well that, you know, with my son being a survivor right now, I have been truly guided with the two gentlemen that you are seeing in front of your screens all throughout this year. So the fact that you are here looking for answers and looking for solutions, I think you are off to a right start. So there. Okay, so for our next question for tonight, coming from Ms. Rhea from Quiapo, breast cancer stage 3, then spine metastasis, how to cure?
Okay, this is stage 4 breast cancer. Okay, so the approach for these kinds of cases, well, at least on my side, no, I approach this metabolically. The terrain is also very important. In other words, your body should be healthy, so immune system should be functioning very well. And lastly, of course, we have to kill the cancer cells directly. So this is the approach that I utilize, no, for these kinds of cases. And since you have bone metastasis, you have to be on a protocol that also helps build your bones or to prevent fractures. I have had several patients who experienced fractures, no, from stage 4, from bone metastasis. Some were even paralyzed. There was one patient whom I have handled. The patient underwent chemotherapy together with my treatments, no. The patient was able to walk again, actually, from being wheelchair bound. Okay, yeah, I actually saw her stand up in front of me. So, what is important here is you follow the protocol correctly, as much as you can. Now, that can be quite challenging, especially if there are financial challenges. But that's the approach that I used, no, for the patient that I had, whom the patient developed. The patient was paralyzed, no. So that's the general approach. I won't say it is a cure. Stage 4 cancer has it's really very difficult to cure. So I would say a patient can definitely go into remission. There are a lot of case reports already here in the Philippines and around the world whom stage 4 cancer patients was able to go into remission. Don't lose hope, but you have to be, strictly on the protocol. Stay on the protocol as much as you can. Yeah.
Thank you, Dr. Jansen. Sir Sean, would you like to add anything?
No, I would always recommend for critical stage cancer, SimplyNature PPAR liquid, because it'll support you no matter what protocols you're doing. And for the elderly, since this viewer is not an elderly, but for the elderly, especially those maybe 70 plus, the decision on what type of treatment when you are stage 4 cancer is not so simple, because it's not like you're a young person. So sometimes you may not go for the most aggressive treatments that give you the highest chance of beating cancer, because an elderly person might actually not survive the aggressive treatment. And as children or the elderly person themselves, they have different priorities. So a good example is my dad. My dad had a cancer scare. He didn't have, it was not a recurrence of the cancer, but he had a cancer scare. So as a son, I asked him, my dad was about 72, 73 at that time. He's turning 80 this year, right? So I did ask him, Dad, what do you want to do? let us know, because if you want to treat your cancer aggressively as children, number one we have to do is prepare the money lang. It's going to be very costly. But my dad actually said to me and my brothers and sisters that he didn't want any chemotherapy because he said his best days are behind him. He just wants to be strong. He doesn't have to live long. He just wants to be strong and not in pain. So that is just an example that when we choose our cancer therapies, there's more than one choice, and there are other factors involved. So for cases like that, the Simply Nature Liquid PPARs is going to be like your best option. Number one, it will strengthen you. So Dr. Jansen himself shared many great examples with his clients who are bedridden. After drinking liquid PPARs, they can walk around. So you have that palliative or that treatment process where you strengthen the patient to have quality of life. And we also have cases where, the cancer actually is managed and actually defeated, even stage 4 with liquid. But again, please remember, everyone, when we talk about cancer, you don't just use one magic bullet. It's not just Simply Nature PPAR liquid, all right? You've got to do every option together. That is the best way to fight cancer. However, in certain situations like my dad's, they don't want to opt for some of the options. But for young people, younger patients, please don't just use Simply Nature liquid extract. Use that together with other options. And if you don't know what are the best combinations, have a consult with Dr. Jansen. Again, we can't advise generally because that will not be effective. We have to know specific types of cancer that you're having and what are the specific protocols your oncologist is recommending to you. And that way, Dr. Jansen can really advise you. That's why a consult will be a best bet for anyone in that position. Sheila?
Thank you, Sir Sean. Thank you, Dr. Jansen. Your example given are very encouraging to our patients. Thank you. Right, for our hello, okay. For our next question.
Junie, you need to mute yourself. Junie. That's our technical person behind. Yeah, I can hear his sound of his beautiful daughter. Yeah.
All right. Thank you for our next question coming from Mr. Daniel. Why does my blood pressure is high, like 144/88 in the morning, but low, like 90/52 at night? I've been monitoring for months right now.
Oh, that's an interesting question, Doc.
Okay, I don't know the answer. So a few factors. It can be because of you waking up, cortisol spike. So that's natural. When we wake up, our cortisol goes up. That's the hormone to keep us alert and awake. Yeah, so that's cortisol. Your cortisol may be too high. So that's one possibility. Another possibility is your blood pressure monitoring device. It might be defective. Seeing that the values is not in the tens, no? So this, I presume, was taken using a digital blood pressure monitor. Sometimes it is not as accurate. So make sure you go to the clinic to get your blood pressure checked by healthcare professionals, no? So it gets checked properly. Okay. I wouldn't panic right now. Just make sure you get diagnosed properly. Then that's the time that you have to accept the reality of taking antihypertensive medication. Because if there is another occasion, if this is consistent, okay, 144/88 or 140/90, if that is consistent, then you are hypertensive and you have to be on medication already. So to keep it low, then just have to do the necessary lifestyle changes so that you can be weaned off the antihypertensive medications. So yeah, for us to know why is it so, why your blood pressure is that high, you have to consult your cardiologist. Okay? I think that's the best person to go to right now. If your cardiologist tells you that there's no problem with your heart or whatsoever, the next doctor I believe that you can go for is an integrative medicine doctor. Yeah. Okay. Especially someone who manages hormones. Okay.
Alright, thank you, Dr. Jansen. For our next question, I like that our questions are coming from elsewhere. But before pala I read the next question, I'd like to greet our viewers for tonight. Starting off with Ms. Jeanette Ku of Child House Manila. Hello po. We also have Ms. Edna Aveo and Ms. Anne Miranda. Thank you for watching us tonight. All right. Hi, Sir Juni. Welcome. Kindly mute your Zoom on your end. Thank you. Okay, so for our next question, Doc, is the PPARs powder effective for rectosigmoid carcinoma stage 3?
Okay, here's my experience. This is just me, okay? This is me, my experience. For cancer, it is always the liquid that is the most effective. I find that the powder is best used as a supportive protocol if somebody is undergoing chemotherapy. But if it is just used, if the patient is not undergoing, chemotherapy, radiation, or something along those lines, then it should be the liquid. Okay, so that is my experience.
I agree with Dr. Jansen, right? Again, it goes back to what we were talking about earlier. What options is the patient going for? If you are opting out of chemotherapy and conventional medicine for personal reasons, it could be sensitivity to the drugs, it could be age, it could even sometimes be finance, right? The reason is because you can't go for one chemotherapy session, you have to go for a complete one. And if you go for immunotherapy, you have to prepare to go on it for a year. So that might be some consideration also. So as Dr. Jansen said, if you are really going like lifestyle and natural, then I would really I agree with Dr. Jansen, go for the liquid, right? One thing, maybe the good news when you're going for the liquid is that when you go for the liquid and your cancer situation improves, financially, if you are feeling drained at that point, right, you could then opt for the powder. In a good many cases, the powder at that point can sustain what the momentum the liquid has created for you. So but you still have to make sure you like cross over the hill. Meron, like when you're riding a bike, right, going up and down a hill, going up part you must cross the tip, then going down is easy, right? I mean, then you have the momentum. But again, it will vary from patient to patient, but that's one possibility. So like what Dr. Johnson said, I would say go for the liquid if you can. All right.
Thank you, Sir Sean. Thank you, Dr. Jansen. All right, we have a question coming from the comment section. Coming from Ms. Anne Miranda. So good evening. I just want to ask po, my father is taking the PPARs powder extract. He had a surgery in throat and lymph node was removed. Biopsy said that he have B-cell non-Hodgkin lymphoma and he do not want to go chemotherapy. Is there a lab test to see if he is cancer-free or T-cell improve or his condition improve after taking PPAR and improve his lifestyle?
Well, Doc,
There are a lot of
sharing about this. Yeah.
Yeah, there are a lot of tests that we can request to check positively, negatively, or the disease remains the same. So for non-Hodgkin's lymphoma, number one, PET CT scan. The PET CT scan will take a look at your whole body and see what parts of your body are affected by the cancer, especially non-Hodgkin's lymphoma, because non-Hodgkin's lymphoma tend to affect multiple lymph nodes that are not connected. Okay, so these are non-contiguous lymph nodes. In other words, directly one, not beside each other. Okay. So another test that we can request is for, especially for the blood, like the tumor markers, would be LDH and beta 2 microglobulin. So those are tumor markers that you can take a look at to know treatment response. Yeah. If you want more advanced labs, The no treatment response, that would be oncotrace by RGCC. The oncotrace test will measure circulating tumor cells. Okay, so yeah, the lower the circulating tumor cells, the better it is for the patient, because that would tell us that the tumor burden of the patient is lower. Okay, so those are some of the tests that we can request for. The easiest one to go for in microglobulin, but you have to have a baseline test. A baseline test. When we go for treatments, like we have to have a measure of before and after. So you have to have, okay. So that's how you would know how, if the patient improved or not. So you have to see a decrease in the results of those tests, not really the reference values per se. Okay.
So for this particular viewer, obviously, since your father has chosen not to do chemotherapy, I think going to see an oncologist to get a CT scan is going to be, how shall I say, weird. or maybe you will hesitate to go and see an oncologist just to interpret the CT scan, and then you tell him, I don't want any of your treatment, right? So as you can see, I think Doc Jansen sounds and seems to be a perfect fit for your case. So why don't you have a consult with him? Doc Jansen is familiar with all the scans that are necessary. He even have some scans that are very innovative, not yet widely available in hospitals, but in the cutting edge providers like RGCC. They have very innovative diagnostic tests, but you can also do the standard tests like the CT scan. And Doc Jansen will be there to be able to answer your questions, and you don't have to be afraid that you have to say no to him, because he himself does not apply chemotherapy, even though he's very familiar with all the chemotherapy drugs. So have a consult with him. Just type into your comments and we'll get back to you. All right? Yeah. And if we don't reply, send another message in a messenger. Okay. And then we will make sure that we link you up to have a consult with Dr. Jansen.
Very quickly, just to echo out what Sir Sean said, for those of you who wish to have a consult, simply type in how to consult. Our caring HCS or healthcare specialist, Miss Beth or Miss Irish, will definitely get in touch with you individually. Okay, for our next question, interesting, still about PPARs powder extract. Question is, in ulcer colitis, is this effective too to stop the bleeding?
No. The bleeding in ulcerative colitis is a different problem altogether. PPARs is not a product to help stop bleeding. So for ulcerative colitis, although PPARs can help with ulcerative colitis, that one, yes, the disease itself, but not the bleeding. For the bleeding in ulcerative colitis, you have to have a different treatment for that. So usually we tend to give hemostat for that for those cases. But PPARs per se, for ulcerative colitis, the disease itself, it will be a very big help, because PPARs has very good anti-inflammatory characteristics, very good antioxidants. It is a prebiotic. So in that sense, in that regard, it can help lower inflammation of ulcerative colitis. Okay. So
Doc, for this case, what kind of concentration of PPARs would we recommend? The tablets, the soft gel, the powder? Yeah.
A combination of liquid and tablets, especially if the patient has flare-ups of ulcerative colitis. Yeah. But there's a big but. The patient must not be bleeding, because if the patient is bleeding or is having a bloody stool, if you take PPARs liquid, you would not know if the bleeding has stopped already, because your stool is gonna turn dark. So for that matter, if the patient is bleeding, then the powder would be recommended. Just the powder, not even the tablets, just the powder. Yeah.
So it looks like for this patient, go and have a consult with Dr. Jansen. But at least now you know that he knows what to give you. He just needs to know the specifics of the condition so that he can give the right dosaging and everything. All right? Yeah.
Thank you, Dr. Jansen. Once again, type in how to consult so we can get in touch with you. All right, for our next question coming from Miss Bev, can PPARs liquid extract help relieve pain in the lower abdomen and lower back? Pain relievers are not working for me anymore.
Wow.
Yeah. For this case, the answer is no. PPARs is not a pain reliever, although it has very good anti-inflammatory properties. But just so you know, no, PPARs can also help. No, yeah, PPARs can also help the body make more water, generate more water. So if the if the problem in your tummy, the one that is causing pain, yeah, if it is a tumor, there is a possibility that more water will be generated and that can, congest the tumor. So there's a possibility that you can feel more pain. But in this case, it would be actually a positive reaction because, the PPARs is actually going inside the tumor and the tumor is reacting. So, if possible, no, you can take the PPARs, and if in case that the pain becomes more severe, you have to be on a more powerful pain meds and just stick with the PPARs. Eventually, the pain should go away because the goal there would be to shrink the tumor eventually. Okay, but you have to be on a more powerful pain reliever. So there's no such thing as no pain reliever is working for you anymore. There would be. There would be. I don't know if you're on opioids already, but if you're not on opioids, best to consult a pain specialist, a doctor that specializes in pain management, to get yourself prescribed with morphine. So that's one possibility. If you're on morphine, you'll be pain-free, guaranteed. Okay. So yeah, that's the next best thing that I think that you can go for since you're in pain. Go see a pain specialist to get that pain sorted out.
I want to emphasize what Dr. Jansen has also said in the beginning, right? Relieving your pain is not going to get rid of the problem. It will only mean that your dosage of the pain relief, be it morphine or any drug that you're taking, it will keep increasing if your problem gets worse and worse. So as you find solutions in terms of getting the pain reliever that will work, right? Also make sure that you take action to treat the primary source of your pain. Okay, or else it's just gonna get you're gonna go heavier and heavier dosage, and then you in the long term you're gonna end up with bigger problems as well. Okay, so go for the pain reliever, see a pain specialist. At least it'll allow you to breathe, allow you to live, but then take that break, right, to really find a solution to what's causing the pain in the first place. Again, sounds like you need a consult with Dr. Jansen so that he can speak to you, and then you can explore more options. All right, Sheila?
Excellent. Thank you. Thank you, Sir Shyan. Thank you, Dr. Jansen. Right, another question coming from our viewer. She's asking about the PPAR soft gel capsule. And question is, I have fatty liver, high cholesterol. Does taking one capsule of this product per day will help to normalize results? Thank you for your reply.
Yep.
Yes.
The answer is yes. And if you take two, it'll be better. All right. So, and I want to encourage you to also take the tablets as well. All right. So get the soft gel and the tablets. The reason is very simple. The soft gel is a concentrated form, one level of concentration. The tablets do provide you a lot of, it's a superfood. So we always, the thing that you mentioned has many factors. Nutrition is part of it. So you want to make sure that you're also covering the nutrition aspects apart from the therapeutic aspect that you're looking for. Okay, yeah. So one will be good for fatty liver, but with that condition, you want to also get it solved as soon as possible if you can. So if you can take, financially it's no problem, then take 2 a day. Don't worry about the dosaging. There's no such thing as overdosaging. So, Doc, I have a very, very good news. My VFA used to be 11 a month and a half ago, and then now it's 7. Yay! So,
Wow.
yeah, so it dropped. I was in Singapore and Taiwan this few days, and I forgot to bring my tablets, but my wife remembered to bring soft gel capsules. So I've been popping like 4 soft gel capsules a day. Right. So just to share with you, this particular viewer, right? Yeah, the thing that limits how many soft gels you can take a day is actually based on your financial strength. Okay, because even healthy people can take extract powder and extract liquid. My ninang and my ninong who invented the product, he actually drinks half a cup of extract liquid every day. That's equivalent to 3 vials a day. All right, so you can see. So the reason he does that is because he's the producer. To him, it's unlimited and so-called free, right? In a way. So it's actually limited only by your finances. But yes, one soft gel capsule should be sufficient. You can check your results after one month to see improvements. Usually things like this will take about 3 months to get the results that you want. Okay, yeah. So be prepared to stay on it for 3 months. But after 1 month, you should already be able to go and check it out. And it may not be normalized or to hit the results you want, but there will be improvement already. Right? But you give yourself 3 months.
Right. Thank you. I like the question, by the way, because seeing in the question the high cholesterol, high blood pressure, or even diabetes, I'm sure all of us have been has someone in the back of our minds thinking of someone who can benefit from this. So I hope that you could consider also. All right. So for our next question, it's an interesting one coming from Ms. Ann Lansang. Question is, early every morning, I go to the bathroom and what comes out is like a lot of gas being expelled. Along with it, there's a bit of stool and it's red. There's really blood. Then I need to drink warm water with Himalayan salt. And after about 30 minutes, I go to the bathroom again and it's like everything I ate flushed out. My question is, why is it that when a lot of gas comes out, it also brings out blood?
To answer your question, the answer is I don't know. We have to find out why. So some considerations that I have in mind though, why you are bleeding is number 1, you might be bleeding from your stomach, so there might be ulcers. Number 2, there might be colorectal cancer. That's another one. Number 3, you might have hemorrhoids. Yeah. So what else? Yeah, these are the 3. These are the 3 that I have in mind that might be contributing to the bleeding in your stool. How do we know which among these is the culprit? If you come see me, the number 1 test that I would request for would be a CT scan. CT scan with triple contrast. So triple contrast means they're gonna give you a dye orally, so you drink it. They're gonna give you a dye through your anus, so it's an enema, and an IV contrast, a dye, injected intravenously. So this is to make sure that there are no tumors found in your digestive tract elsewhere in your body. So these are the considerations that I have in mind. I need more information, so I have to talk to you to make the right recommendations. But that's just what I am thinking. Those are the 3. Now, if you're bleeding, this is something, your case is urgent because chances are if you're bleeding, you'd be anemic. And if you're anemic, then it would be very difficult for your body to live. Yeah, it's gonna be very uncomfortable. You're gonna be lightheaded most of the time. And it's not good, because lack of oxygen in the body, that can damage your organs. So you have to go see your doctor immediately. Okay?
Sir Sean, would you like to add anything?
Yeah, I just wanted to share that, in my conversation with Dr. Jansen like 4 or 5 years ago, Doc Jansen always mentioned that I asked him, what kind of work would he like to be doing for like a long time? And he said he would always like to do like interesting medical cases, things that challenge him. So whenever Doc Johnson says, "I don't know," you'll notice he seems to be very excited because it's like he I don't know. It's actually like something that stirs him up and gets him excited to want to treat the patient, to want actually to discover what's happening. So again, I would encourage everyone, and I think this is why viewers enjoy our program, right? So we are learning together and we are exploring together. Yeah.
Thank you, sir. Thank you, Dr. Jansen. Okay, for our next question, well, this is something about the Cleansing Plus. So the question is, how long can I take it? Or one common question about Cleansing Plus is it safe to be taken on an everyday basis, the Cleansing Plus?
Yeah, I'll answer that since I'm the manufacturer thing. Yes, it is, right? Yes, it is. All right, but as with all things, right? Cleansing Plus is a dietary fiber. Is it safe to take every day? Yes. Now, when you'll notice that with dietary supplements, sometimes if you take it all the time, it will start to lose some of its effects. Okay, it's like the body gets used to it. So you would then have to take a break for 1 or 2 weeks. And then when you take it again, you notice the effects that you're used to comes back. Okay, for Cleansing Plus, I don't know about Dr. Jansen's personal recommendation, but my recommendation is, my approach to it is, I will use Cleansing Plus like especially on the weekends. All right, my wife just made it law in my lifestyle. She told me, "Dear, choose a day once a week, you go and take your Cleansing Plus." So I have to choose the day that the next day I know I'm not traveling anywhere, right? Okay, because as I age, I'm 51 this year, I do realize that it is important to keep my bowels clear and clean. Doc, it's very interesting, Doc. I go to Singapore and just 3 days, 4 days, no, sorry, 1 week there. On my second day there, my feet start to hurt already. It's like the soles of my feet start to hurt. In TCM, there's this term called 湿气, which means dampness. Apparently in Singapore, we are very humid, right? And this like creates the Chinese one is dampness. And I'm not in pain, but my bottom of my feet is like slightly sore. And then I will look bloated when I'm in Singapore. Believe it or not, when I come back to Philippines, it only takes 1 day. I would like be dehydrated, like the water gets, and I look slimmer. And that means in Singapore, without even drinking anything, I look like swollen. So it's very interesting, because I think my body's acclimatized to Philippines already, compared to a Singaporean who has stayed in Singapore. So I'm sure if I stay there after 6 months, I won't look so bloated. My body will adjust. But yeah, it really can change so much, right? So what I want to why I say this is just that we should take care to cleanse ourselves, especially as we age, if we want to be healthy. At the same time, as Dr. Jansen always said, I do want to be able to eat a more healthy lifestyle as well. So for those of us who have constipation problems, right, use the Cleansing Plus to solve the problem, but also start changing your lifestyle so you don't have to take Cleansing Plus every day, maybe once or twice a week. But yeah, to first answer your question, yeah, it is safe to take. Now, do I want to be taking Cleansing Plus every day like that? I think I want to have increased fiber intake in my diet so that I don't have to take Cleansing Plus every day. But yes, it is still safe. Doc, what do you think?
Well, it depends on the goal, really. There are a lot of use of Cleansing Plus, actually fiber in general. One of the few things that I use it for is weight loss. Another one is to lower cholesterol naturally. Um, Detoxification, yes, I do, but seldom. At least if I use it for detox, the dose is gonna be less compared to, if a person is trying to lose weight or trying to, shed off cholesterol. Yeah. So really depends on the goal. Now, in with regards to detoxification, my take is you have to detox regularly, regardless of the age. Even when you're just, in your teenage years, children, teenagers, young adults, up to, the more senior citizens of our population. Um, the the food that we're eating are, we tend to eat junk foods. It's very difficult to follow a very, very healthy diet, especially if you're living in countries that have very high obesity rates. Um, Let me just talk about Southeast Asia. No, Asia at least East Asia in general. No? From China, Japan, Korea, down to Malaysia, Singapore, Indonesia, Thailand, Vietnam, those countries. The Among those countries that I have mentioned, the country that has the least obesity rate is Vietnam. If you look at the Vietnamese cuisine or Vietnamese diet, or just here in the Philippines, go to a Vietnamese restaurant, compare the menu there to other restaurants. They are very, very heavy on plants. So that's why they have very low obesity rates. So that alone should give you a very good idea what kind of diet you should be following. Okay? Now, obesity is a condition that is a risk factor of a lot of diseases. A lot of diseases, no? Cardiovascular diseases, metabolic diseases, cancer, allergic diseases, a lot of them, musculoskeletal disorders, a lot of them. So, if you just have a normal BMI, or if you're not overweight, just the fact that you are not overweight, that goes a long way. Okay, that goes a long way. And the need for detoxification, or the need for you to, have a regular bowel movement, would be less. But it's always good to have regular bowel movements when you expel those toxins, those bad things, no, out of your body, regularly, on a regular basis. Okay. Now, if you are someone who really needs help, no, say for example, constipation is really bad, you're obese, you want to lose weight, then I have to see you, because this has to be the approach to this should be step by step. We cannot make drastic changes, because this is a long-term solution. So long-term, this is a long-term problem, so you need long-term solutions. So long-term solutions don't just don't just happen overnight. Okay, it has to be, you have to live it, you have to be on it, on the protocol for as long as you can, and we make changes along the way. So it's a journey, in other words. Okay. Yeah. So that's what I think about it, my take on it. So yeah.
Yeah, so we gave a very long answer to a short question, and just to go back to original, yes, it's
that makes me love the question even more. Thank you, Dr. Johnson, for your answer and the sir. So for our next question, coming from Ms. Yumi Chang Chang. Doc, may I know your take on an alkaline-based diet or vegan diet, especially on cancer patients? Thank you.
The default diet for cancer patients is a whole food plant-based diet. A whole food plant-based diet is a diet that is centered around plants, and you only eat plant foods which are unprocessed and unrefined. Okay? So whole plant foods, food is grown, natural, minimally processed.
Yeah, not your Beyond Meats and all that. They have
Yes,
like
yes.
40 different types of chemicals in there, right? Just to make it taste
Right.
like, yeah.
Right, right. So now a whole food plant-based diet is a vegan diet. Healthy. Because what Sir
Yes.
Shyan mentioned, no? Beyond Meat is plant-based, but it's not healthy. Your French fries is also so yeah. You can, for cancer patients, you can go for a vegan diet, but it should be a whole food plant-based diet. Okay? A whole food plant-based diet is an alkaline-based diet, but this acidic diet or alkaline-based diet is also a misnomer. Um, it's just what pop culture labeled it as such. But if you really think about it, anything that goes into our stomach is acidified because the stomach is acidic. Okay, why is it acidic? Because to digest food, you need acid. Okay, it's what it is. Now, when the food is mush already, liquefied, no, that's gonna go into your small intestine to be alkalinized. The small intestine is not acidic; it is alkaline. Okay, it actually has one of the most powerful. Yeah, it's to neutralize the stomach acid because if your stomach acid goes into your small intestine will be dissolved. Okay, so it's not good. Now, when the food in your small intestine goes into your blood has its own pH regulating mechanisms as well. So it will automatically adjust the pH of your blood as needed. If not, so there's if your blood is too alkaline or if your blood is too acidic, you're gonna die. Okay, so the alkaline based diet or acidic diet is actually a misnomer. It doesn't, it doesn't have that effect on the body. So what I rather prefer is for cancer patients to be on a whole food plant based diet. Now, if there are difficult, and that's the time that we make compromises. Okay, I won't discuss those compromises here because it's not within the scope of the question anymore. But the default diet of a cancer patient should be a whole food plant-based diet.
I want to comment about this acidic and alkaline too, because when we first started the wellness journey, most of us hear acidic, alkaline, and alkaline is like healthy. So I have a Kangen water machine in my house, right? So there is a alkaline level of the Kangen water as well. Now I'm Chinese by ethnic group, so TCM is definitely in our. In TCM, we have this thing called heaty and cooling foods, right? Heating and cooling foods. So I asked him, is heaty foods acidic food and then cooling foods alkaline food? So he said, no, it's not. Okay, so it's not a direct translation. So over the years, this is just my opinion. I've come to realize the acidic alkalinity thing for health is not as important as foods that promote inflammation and foods that promote antioxidants that help you manage inflammation, right? I think that is actually more directly, I guess, from a biochemistry point, from a body pathology point of view, has a more direct impact on a cancer patient. If you are eating foods that promote inflammation, it's going to cause your cancer to grow faster, right? If you eat foods that are anti-inflammatory, you're going to make it harder for your cancer to grow. So I think that effective than the general acidic analogy that we normally start off with in our wellness journey. Okay, so I do notice also in Chinese TCM, heaty foods, the symptoms that heaty foods cause illnesses and the discomfort that comes with inflammation. I don't think it's a direct correlate. I don't think it's exactly the same thing, but they demonstrate a lot of similar properties. So for the Chinese one, they actually want balance, right? They don't actually just want you only eat cooling foods, because if you eat too many cooling foods, it's not good also. So you have to have a balance. And actually that makes sense even in Western medicine. You got to have inflammation in your body. It's a necessary function of your body, but you don't want to have chronic inflammation, right? So again, I think eating vegetables, eating a plant-based diet, like steamed vegetables, sitao, right? Steamed sitao or even stir-fried sitao, these are all real vegetable foods. I always joke with my wife when I was a carnivore, Dr. Jansen. When I'm eating my French fries, I always look at her and say, I'm eating my vegetables. but it's not, right? But as Dr. Jansen said, it's not. So I hope this discussion is an interesting one. And Doc commented about acidic and alkaline as per your question. I also agree with him. I think what's more useful is when you do searches and when you're looking for dietary nutritional strategies, look for foods that are anti-inflammatory. That will be more anti-cancer than alkaline foods, right? Yeah.
Right. And we are not only talking about patients, we are also talking to healthy people out there. Please consider the tips that Dr. Jansen is giving. Just to echo out, go for whole food plant-based diet by Dr. Jansen Kalalan. And if you wish to have a consult with him, just simply type in how to consult. We'll definitely get in touch with you individually. Okay, let's try to answer 2 more questions for tonight. So coming from Mr. Edmund, my wife have been using PPARs powder for 6 months. Now her stage 2B breast cancer is already cleared. Thank you, Lord. So all tumor markers are normal. Normal now, PET scan reveals positive results as well. So how many PPARs tablets will she take daily as maintenance? So the question is about downgrading to a different PPAR form. So from PPARs powder, what would you suggest?
Okay. Before I would just recommend 20 tablets a day of tablets just as a maintenance. Now we have to have a measure still. Negative PET scan doesn't mean that you're cancer free. Normal tumor markers doesn't mean that you're cancer free. We have to know if the circulating tumor cells are normal or zero. So right now, if a patient is in remission like this, no evidence of disease in PET scan, normal tumor markers, no clinical signs and symptoms of cancer, I request for another test, which is a liquid biopsy test. So the name is Oncotrace. Oncotrace is a test of RGCC. Now, this test measures circulating tumor cells in your blood. If that is positive, then you still have cancer. You should still be treated as a patient who has active cancer. So the treatment should not be downgraded yet at this point. Now, if the patient comes back with zero Oncotrace result, that means that the circulating tumor cells is zero already, and you have 3 consecutive tests that's zero, then that would be a patient who's truly in remission. Okay, we can actually even claim the patient is cured already from cancer, from the cancer that the patient has. Okay, now from this point, what supplements would I then recommend for the patient? We have to have another test, which is called the immune frame test. Now, the immune frame test will tell us how well the immune system is fighting cancer. So, depending on the result, there are supplements that can be used, natural extracts that can be used to change or to manipulate the certain aspects of the immune system in fighting cancer. So that's how I would know what supplements to use, how much dose, and in this regard, this would have to be a maintenance. Okay, because this is your immune system that we're talking about, and we want your immune system to be able to fight cancer well. All right, so this is how proper recurrence prevention of cancer should be done. So it's not just blindly recommending whatever supplements. Okay. Now, if the patient would just want to, if the patient doesn't want to undergo any tests anymore, just want to take supplements, then that would be at your own risk. But at this point, I'm going to stick with my previous recommendation, which is just 20 microtablets of PPARs every single day. Okay. But keep in mind that if we do so, we don't have a measure of whether currently at the current state, it is okay to downgrade from powder. Okay, because the PET CT, a normal PET CT scan, again, a normal PET CT scan, normal tumor markers, no clinical signs and symptoms of cancer, it is not enough to declare someone in remission. Okay, because I have seen a lot of patients who have achieved this, but 2 years later, 3 years later, a year later, cancer comes back. Okay, so I leave it at that.
I actually have comments about this. I feel strongly. Yeah, no, I feel strongly about this the same way Dr. Jansen has, because this is what happened. This is what my personal experience. I've met cancer patients, right, who sit down right beside me, and when they find out what I do, what's my work, they ask me, my cancer came back. So what did I do wrong? They said that, right? And then when I asked them this, they said, yeah, actually I was in remission. I mean, all the scans came out negative. So the family and I, we celebrated. We thought we fought a hard battle and we won. And then then they are so disappointed. And then they say to me, but then 6 months later, now they tell me the cancer has spread all over my body. Right, and then they say this question, what did I do wrong? And just like what Dr. Jansen is saying now, you didn't do anything wrong. You just didn't do enough. Obviously, you did something right, which is why your tumor markers went back to normal, or your CT scan was negative. You did something right, but you didn't do enough. You stopped too early, right? This is the thing. So what Dr. Jansen has shared with all of us is really the next level. Based on our understanding, we have new diagnostic tools that allow us to check for cancer in a totally different way from the old days. The old days, we are literally looking for something big enough to recognize as a cancer tumor, right? We actually trying to look for cancer clusters big enough to be detected. But then again, the problem is, it's not like you're a healthy person developing cancer the first time, okay? These cancer cells may be as small as the first time where you were a healthy person, you had small cancer cells that slowly develop into a tumor. This time around is the same thing that's happening, but there's a big difference. This time round, these small cancer cells are commando war veterans. They have survived your chemotherapy. They have survived your body attacking it. So they are definitely like super trained. So when they come back with a vengeance. They are like trained. They are like veterans from a war. So it's different from your first round of cancer. Your first round of cancer, those are first-time warriors, right? First-time cancer cells. These ones that come back because they're circulating in your system are definitely stronger, more aggressive, mutated to be more effective. Mutations for diseases, right? Mutations seldom become less effective. They usually mutate to become even more aggressive, right? Because the mutation is not like a flu where it is mutated, because viruses themselves are not stable. They're always changing. So sometimes they mutate until they become easily managed, part of the environment, part of the ecosystem. But don't forget, your cancer cells mutate under the pressure of chemotherapy. So they are actually mutating to protect themselves from the attack of your chemotherapy. So these type of mutations make them more and more vicious, if I'm going to use strong words to help you understand. Okay, so I think in today's cancer care, what is available now is to be very proactive and to be even more thorough. Just imagine, right, doc, oncologists actually prescribe what's that called? Preventive chemotherapy. That means everything is clear already. They're still going to give you 2 more cycles just in case, right? Why would they do the just in case? Because they also know just because the CT scan is negative doesn't mean that your body doesn't have cancer cells. So the fact that they have a protocol to give to a person whose CT scan is clear it's called preventive chemotherapy tells you that the scans are not enough. So everything that Dr. Jansen said, I hope it's useful for all the cancer patients. Again, if you want more, join us next week. Ask the same question. We'll elaborate because time is up. If you want to know specifically what to do for yourself, have a consult with Dr. Jansen so that he can hook you up with the diagnostic centers that can do some of this. And then you will be able to sleep better knowing that you've done all that you can do, right? Yeah. Sheila?
Sorry, I'm on mute. Thank you. Yes, exactly. I just want to reiterate, this is not something to discourage, but actually, if there's one thing, very important thing that I've learned from Sir Shyan and Dr. Jansen is always the early detection and not be complacent, even though you feel that you are already in the best position. So always be proactive. So just before we go to the last question, okay, just want to say to Miss Melinda Hispano is greeting Doc Jansen. She says that she is your patient from Muntinlupa City. You have a fan, Doc. Okay, and
Doc
then
has many fans, not just one.
oh yeah, I agree. I agree. So for our last question for tonight, coming from Miss Anne, how can a 2-year-old liver cancer patient done with surgery and chemotherapy but has metastasized to the lungs take PPARs? Can it be mixed with food?
Okay, PPARs, ideally it should be taken on an empty stomach, as much as possible. Now, if we have problems with taste, then that's the time that I consider mixing it with food, but not with milk. Okay, even plant-based milks. Now, for a 2-year-old child, though, I would initially recommend the powder. I had actually a same patient before. Also, right now, I think she's 3 or 4 years old already. Liver cancer as well. But this patient was able to survive. She did not undergo surgery. She did chemo, but not surgery. She responded well with the chemo. We monitored her for at least 2 years, and the tumor did not recur. Tumor markers were low, very, very low. The metastasis to the spleen actually was gone. It was just the calcified lesion in her liver. Right now, I haven't talked to the patient yet, but last time I checked with them, the size of the calcification or the remaining lesion in the liver is still the same size. So the patient is very, very active. So I think the patient is well. So that patient of mine was started on the powder. Then I shifted her to liquid, but she had trouble digesting it. So I had to shift her again back to powder. So for a 2-year-old child, the only problem that you're gonna have is the taste. But it shouldn't be a problem because the children's taste buds are quite, how should I say? They're quite adaptable.
Yep.
Is it the proper term, or they're easy to adapt to the taste? You just have to convince them.
Yeah, 2-year-old, right? 2-year-old. In fact, baby food tastes crappy. If anybody's ever eaten baby food, like those spinach blends and things like that. So I just want to share with the viewer my experience with toddlers and those under the age of 5. I have actually never met a kid that didn't like the PPAR tablets. Very surprising. Especially kids that have never eaten sweets before, they have no problem eating PPAR tablets, chewing PPAR tablets. I myself don't like to chew I don't like the taste of chewing PPAR tablets, but I've noticed young kids don't have a problem. So shouldn't be a problem with your child, especially liquid. You can get a dropper, right, to slowly drop it under the tongue so that they don't choke or anything, right? Just do it slowly over a minute or so. I think that is shouldn't be an issue. You don't have to mix it with food. Sayang lang is such a precious extract. You don't want to dilute it. Yeah, correct.
Thank you. Thank you, Sir Sean. Thank you, Doc Jansen. We're almost at the end of the webinar. And as we wrap up this evening, we would love to hear your final thoughts for our viewers tonight. Would you like to start?
Yeah, I'll go first. Yeah. So I just want to thank everyone for attending this webinar tonight. No. Again, very unique questions that we get that we have tonight. It's good. So keep on asking those questions because there are a lot of viewers who are first time here and we would love to hear the questions of the other viewers, learn from one another. So keep them coming, and I'll see you next week. Yeah. So good night, and thank you. I'll give the floor to Sir Shyan.
Thank you, Doc. Truly, tonight's questions were very interesting. And also tonight's questions, many of the viewers who asked the questions, I just want to encourage you, have a consult with Doc Jansen, because from where I am sitting, hearing the question and hearing Doc Jansen's initial answer to you, I think he's the right doctor to give you the solution you're looking for. Or you can tell from his answers, he knows the condition that you're in, and he already has starts to have a plan on your treatment, how to support your cancer fight, or for some of the cases, how to investigate and find what's really challenging you in terms of your body. So I think, and as you can tell from our program, right, Doc Jansen is easy to talk to. Again, my last parting words, because today, and I think the next coming few weeks that is to come, we have viewers that are asking very, very specific health conditions, and we're always very happy to answer them because it's very interesting and everyone learns. I just want to remind everyone, that our program is meant for education. It is not a consult. So I know sometimes we are thinking, hey, can we get a free consult by asking questions in a program like ours? Don't do yourself that disservice. You can ask us questions and we're very happy to answer. But please understand, the answers that we give is an education for you to help you understand in a textbook situation that you have mentioned, what would the scenario be like? But it can never replace an actual consult, right? So if your illness is serious enough, go for actual consult. The advice that we give you is for educational purposes because there are too many things that we don't know, that we aren't looking at. And since this is not an totally interactive, it's not like your face pops up and we're having a conversation, right? You're typing something and what you type is not complete as well. And you might be missing out some stuff and that you didn't know to tell us. And when we ask questions, you can't really respond immediately. So again, please remember to go for a consult if you really have a serious illness and you are looking for specific advice, okay? But we look forward. We're happy to answer your questions. We're going to do so again next week. Looking forward to it. So I'll hand the time back to Sheila. See you all again next week. And again, thank you for making this program worthwhile doing. We've been doing it for 4 years. I think this is our 5th year. We've only taken 2 breaks or 3 breaks out of the last 4 years. So this is looking forward to see everyone next Thursday. Sheila?
Thank you, Sir Sean. Thank you, Dr. Jansen. Right, yeah, actually, on behalf of our patients and viewers tonight, thank you so much to the both of you for answering our questions. And if you or your loved one is battling any type of cancer or any health issue at all, remember, science is evolving and new treatments are emerging all the time. Keep informed and explore all available options. So please don't forget to like our Facebook page, Simply Nature International, and Dr. Jansen Calalan's Facebook page, Simply Healed Medical Group, and subscribe to our YouTube channel. This is also to make sure that you keep yourself updated with our latest promos and events. Now, don't miss our free price adjustment promos because these special promotions are still ongoing up until July 14. So if you're planning to purchase Simply Nature PPARs Liquid Extract or PPARs Powder Extract, now is the best time to get them at the most affordable rates before there is price adjustments. No, reach out. What do you need to do? Reach out to your assigned Simply Nature client service officers. It could be me, it could be Ms Janelle, it could be Ms Karen or Ms Daisy. Please reach out to them so you can learn how to you can take advantage of this limited time offer. So act now before the price update takes effect. So you can purchase all of this on a most affordable price only at our BGC office or the Simply Nature website at www.simplynature.ph. Okay? Now is the time to prioritize your health and your family's well-being and experience the proven benefits of PPARs at an unbeatable price and take control of your wellness journey starting today. So once again, thank you for your questions. Thank you for spending your time with us today. And we hope to see you next Thursday. That's another webinar happening on July 17th, also at 7:30 p.m. So yeah, same day, same time. So your commitment to healing and recovery inspires us. Remember, every step you take is a step forward, and you don't have to walk this journey alone because this is Simply Healed webinar powered by Simply Healed Medical Group and Simply Nature International. And your curiosity about your health conditions and your victories over cancer and metabolic diseases are what keeps us going. Because here in Simply Nature, we are always with you from start to healing. Thank you, everybody. Good night, and God bless you all.
Actually, walang tao na cancer-free. We have 20% cancer in our body na pwede yang mabuhay pag pinid ulit natin sila ng wrong food. Natutulog lang sila, nahihilo pa lang. So, kailangan yung sundalo ng katawan natin mas malakas kesa kanila. Yes. Uminom ka ng PPARs, gagaling ka. Talagang walang aksidente. God-given po. Thank you po.
Breast cancer stage 4 patient, and they tested SimplyNature liquid PPARs on the breast cancer cells. And what they found was that SimplyNature PPARs liquid actually induced caspase 3, caspase 9, and cytochrome C. So what this means is that SimplyNature PPARs liquid was able to induce cancer cell death in breast cancer cells of a breast cancer stage 4 patients. So with just these three properties of SimplyNature PPARs, it would go a long way already.
You gotta watch all your comorbidities. Our products are actually very effective for inflammation, very effective for managing blood sugar, blood cholesterol. All right. If you're using metformin, PPARs is actually clinically proven to work in synergy with metformin. So you gotta watch. That means your metformin dosage will be tailored downwards because you don't need so much metformin. It actually works in synergy together.
It enhances the immune system, so as you can see, helps you minimize the side effects of the chemotherapy. So it has good antioxidant properties, good anti-inflammatory characteristics.
SimplyNature! Always